The Hancock Chamber is here at the top of the Hancock Whitney Bank building in beautiful Bay St. Louis, bringing to you the Hancock Health Minute, brought to you by Covenant Laboratories. And with me today is the owner, Michael Parrott. Michael, the number one thing on my mind is what is going on with COVID. We're seeing all of the numbers spike. Everybody's concerned that they're going to get COVID. Events are being canceled. What are you seeing out there?
Seeing the same thing, Fish. It's just the numbers have just gone up and they'll come down. This spike we're seeing right now, if you talk to any urgent care facility in this area, Southern Louisiana, everybody was waiting. They knew coming between Thanksgiving, Christmas, and the New Year, with everybody getting together, we were going to see an impact. And it's here again. And of course, with the Omicron variant, first the summer we saw, or midsummer, we saw the Delta variant. Mm-hmm. Now we've got the Omicron variant. And here's the thing, Tish, unfortunately, it's not going away because the viruses do what viruses do and they mutate. Unfortunately, that's what they do, and you can't kill it. So what we have to do, of course, is all the things. What can you do? Of course, there's the masking and the hand washing and limit the number of people that you're around in public places, public events, things of that nature. Unfortunately, people they want to live. This whole new normal thing, I rebel against it too. I want to be out and be with people. I don't want to sit around and just, wait to see what happens. I want to be with people and talking and be a part of the solution.
And one of the things that I've found too is people don't know where to go to get tested.
That's right. Unfortunately, the COVID testing has become more available. And one of the reasons I'm in Bay St. Louis is because there's a need in rural Mississippi, rural areas across the nation, to be able to provide that high quality, high sensitivity, high specificity testing that we can definitively identify. Do you have COVID or do you not?
And so if they are seeing that they have the symptoms and they want to get quick turnaround testing, they need to come to Covenant Laboratories. And tell us how they can do that.
There's two ways you can do that, Tish. First way is you can get an order from your physician, bring it to us. We can order the test, bill your insurance, and we'll get you results. The second way is if you don't want to go to your doctor, you can come to Covenant Laboratories. You can call us, show up at 290 Hancock Square Drive, which is right near La Chula restaurant. It's behind the Tim's Drive, and at the T, take a left, and we're right there. And you can walk in, we can swab you for $99 and have you results back within 24 hours.
That's amazing. So if they want to make an appointment, how do they get in touch with you?
Our phone number is 228-400-4790. Call. If you don't get an answer, please leave a message. We'll call you back. Had to do that a lot of times because sometimes just not enough hands to be able to grab every phone there. But we will be able to see you and get you swabbed and taken care of and tested very quickly.
And that's the most important message, is quickly. That's what we want. We want to know the answers as soon as possible.
Right.
So Michael, thank you so much for what you're doing here in our community. Instant testing, I guess you would call it.
I don't know if it's instant testing, but it's rapid testing. We're able to get the results to you quicker than some other areas because I've talked to several people that have 3-4 days before they get results.
Right.
If you look tomorrow, we'll have a sign out there. Hopefully you can see that. It will be right at the Thames Road. And then also, if you don't mind, I'd like to speak one more thing just to show what we're seeing here in Southern Mississippi. Unfortunately, we are seeing what I believe is the beginning of a quick trend of going up in cases. I did some research and looked at the southernmost 6 counties that we have here. Hancock actually has the lowest number of cases per.
I saw that yesterday.
Per 100,000.
Yeah.
So the numbers I talk about is a per capita per 100,000. And from 10 days ago, so from December 24th to today, or to yesterday, we saw a case of going from 3 cases a day to 30.
Wow.
Pearl River, same time frame, 9 to 103 cases a day per 100,000 people. Stone, 13 to 53. This one's kind of a heads up on this one. Harrison County went from 7 to 82, and they're ranked number 2 in the state as the highest per capita COVID positivity rate. Jackson is right behind it at number 6 with, they went from 6 to 88. And George is at, went from 3 to 52. So what does all that mean, Michael? It means the cases are going. What do you do? Of course, follow all the guidelines the CDC provides. The data that I just provided, you can go to covidactnow.org, or you can visit our website. You'll find that information, or like us on Facebook. We have that information posted there. We've been posting what the trends are that we're seeing, and be able to minimize the overload of the urgent cares and the hospitals, because people won't want to be tested. And that's what we'll be able to do, is provide that testing and provide you a rapid result. So you can identify, do I need to isolate for 5 days? Do I need to go back to work? Go to school, whatever the case may be. You can make decisions based off that, because, Mississippi is the lowest number of, has the lowest number of vaccination rates. I'm not a pro-vax or an anti-vax. I'm just science-vax. I'm a scientist and I look at the data. If you want to get vaccinated, that's something that you could definitely do. But there's some people that don't want to. That's their choice. Having the vaccine does not mean you're COVID protected from COVID. Shortly after I had the vaccine, about 3 months later, I wasn't feeling well. I had COVID, and I had both injections. My son this past week had COVID. So
I think the most important thing that I just heard you say is that you do have the symptoms and you want to get tested rapidly, go to Covenant Laboratories. They're going to be there for you 7 days a week. And then if you're positive or negative, then you know the decisions that you need to make for yourself, your family, and your friends. Thank you for joining us today for the Hancock Health Minute, brought to you by Covenant Laboratories.